chard, kale, collards, mustard greens.
The desert Southwest provides a year-round climate for growing fresh food to fuel a nutritious diet. But organic produce like this isn't always within reach.
We know that healthy, organic, locally grown food is often really expensive. And if it's only available to folks that can afford it, how will we ever really know the impacts on the folks who really need it?
Pivot Produce, run by Eric Stanford, sources the items from more than 30 various local gardens and growers. Pivot partners with the Fresh program here in Tucson, Arizona.
Our goal ultimately is to help prove to, maybe the clinic organization as a whole and to Medicaid nationally that when we provide things like food supplement, that we do have better health outcomes.
Holly Bryant is the dietitian director at El Rio Health, a federally qualified healthcare center where the Fresh program is helping 50 people as part of a National Institutes of Health funded study. Like the Fresh program, there are dozens of programs across the country, both federally and privately funded, prescribing produce for better health, like Fresh RX Oklahoma distributing food in Tulsa, or Food for Health in New York City, partnering with local farmers. All kinds of fresh produce from gardens like these will go to help adults who are both food insecure and struggling with type 2 diabetes.
It's a bit of a flip on the way we think about health and the way we think about how food impacts health.
Participants have their prescriptions filled every other week for 6 months. Jose Silva Pena has type 2 diabetes.
The food they gave me nourished me more. It helped me not take so many pills, not to inject myself. I see that my sugar is regulated.
¿Y qué comiste antes?
Beans like other Mexicans and tortillas and things like that. Well, they raise your blood sugar. I can't eat very nutritious vegetables because they are more expensive.
A 2023 study found that if an estimated 6.5 million adults like Jose were prescribed produce for an average of 25 years, it could save nearly $40 billion in healthcare costs.
Just like they're going to pick up their medication, they can also pick up food. Again, that kind of food as medicine model, and that it does lessen the burden on the healthcare system.
Food as medicine for a future full of healthy possibilities. Valerie Castro, NBC News.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.